When your doctor discusses your B-cell lymphoma with you, they will identify the specific type you have. This is crucial because each type of this cancer behaves differently and requires its own unique treatment. To determine the type of B-cell lymphoma you have, your doctor will perform a biopsy, where they take a sample of your cells and conduct tests on them. Additionally, you may need to undergo tests such as CT scans, PET scans, and blood tests to gather more information about the cancer and its potential spread. Doctors categorize B-cell lymphomas based on the appearance of the cancer cells under a microscope, whether the cancer cells display certain proteins on their surface, the specific gene changes present within the lymphoma cells. Diffuse large B-cell lymphoma, DLBCL, is the most common type of B-cell lymphoma. It grows quickly, but it can be cured. Most people are diagnosed with this type of lymphoma after the age of 60, but it can occur at any age. This cancer often starts in the lymph nodes or other areas with lymph tissue, but it can also start in other parts of the body such as the bone, skin, intestines, or brain. Doctors categorize DLBCL into subtypes based on how it looks under a microscope and where it is located in the body. Knowing which subtype you have will help you and your doctor choose the right treatment. One subtype, called primary mediastinal large B-cell lymphoma, PMBCL, mostly affects young women. It grows in the mediastinum, the part of the chest between the lungs and behind the breastbone. PMBCL is rare, accounting for only 2% to 4% of all non-Hodgkin's lymphomas, but it grows quickly and can usually be cured with treatment. The main symptoms of PMBCL include cough, shortness of breath, and swelling of the face and neck. Follicular lymphoma, FL, is a slow-growing type of B-cell lymphoma, accounting for about 20% to 30% of all non-Hodgkin's lymphomas. This cancer typically affects people over the age of 65 and commonly starts in the lymph nodes and bone marrow. The initial symptom is often swollen lymph nodes in the neck, armpit, or groin. While there is no cure for FL, it can be managed with the appropriate treatment. This type of lymphoma starts in the marginal zone of the lymph nodes, where there are a lot of B cells. It is a slow-growing cancer and makes up about 8% of all non-Hodgkin's lymphomas. Marginal zone B-cell lymphoma is usually diagnosed in people in their 60s. You may be at a higher risk of getting it if you have had an infection with the H. pylori bacteria or hepatitis C virus, or if you have autoimmune diseases such as rheumatoid arthritis, Sjogren's syndrome, lupus, or Wegener's granulomatosis. B-cell lymphoma types include chronic lymphocytic leukemia, CLL, and small lymphocytic lymphoma, SLL. These two types are very similar because they have the same type of cancer cell and they both grow slowly. The main difference lies in where these cancers start. CLL mainly starts in the blood and bone marrow, while SLL mainly starts in the lymph nodes. Mantle cell lymphoma, or MCL, is a rare and aggressive type of cancer that starts in the B cells of the mantle zone, which is located on the outer edge of the lymph nodes. This type of cancer often affects the lymph nodes, bone marrow, and spleen. If you have MCL, your body produces an excessive amount of a protein called cyclin D1. Doctors can measure the levels of cyclin D1 and other proteins to help predict how likely the cancer is to spread and determine the most effective treatments. Burkitt lymphoma is a type of cancer that grows very quickly, but it can be cured. It makes up about 1% of all non-Hodgkin's lymphomas in the US and is more common in children and males. In the US, Burkitt lymphoma usually affects the belly and can also impact the intestines, ovaries, testicles, and other organs. There is also a different type of Burkitt lymphoma that is more common in Africa and typically occurs in the jaw or bones of the face. There are three different types of Burkitt lymphoma: endemic Burkitt lymphoma, sporadic Burkitt lymphoma, and immunodeficiency-related Burkitt lymphoma, which affects people with HIV, AIDS and those who had an organ transplant. Under a microscope, Burkitt lymphoma cells look similar to DLBCL, but one key difference is a change to a gene called MYC. It's important to distinguish between these two cancers because the treatments are different. Lymphoplasmacytic lymphoma is a type of B-cell lymphoma that is rare and tends to grow slowly, but it can transform into a faster-growing form. It is typically diagnosed in people around the age of 60. If you have this type of lymphoma, your body produces an excessive amount of a protein called immunoglobulin M, IgM. This can lead to symptoms such as easy bleeding and feeling weak or tired.